Let's talk about timers. You'll notice pretty early on that we have timers going on all day long. I often joke that each department within our clinic has a noise that they're accustomed to hearing. For our patient care coordinators up front, it's the ring of the doorbell as people walk in. Their eyes lift from their computer up to greet that patient. For our providers, unfortunately, it's loud noises. We don't like loud noises, as this typically means that there was either something that sounded like a fall or a fall that occurred. Now, falls have been minimal in our history in our company, but they do happen. So when we hear loud noises, our heart drops. But for our exercise specialists, it's our timers. I've often joked with patients that when I was an exercise specialist, I would hear these in my sleep. But these are integral parts of us being able to maintain that flow and make sure that our patients are doing exercises for the right amount of time and in a prescribed way by their provider. Now, we use timers to time our heat setups, our ice setups, and we also use it for exercise. The most important thing about timers is they are a very important tool to stay on top of. A patient should never be left on heat beyond when the timer goes off for any length of time. When a timer goes off, a provider should immediately be involved in the decision-making process for what's to happen next. When a timer goes off, it's not to be pushed and walked away from. Now, we don't expect perfection, but we do expect your best efforts to make sure that there's no patient that is staying on a heat or ice setup longer than they should, or performing an exercise longer than they should. Let's talk about why for a second. While it might seem harmless at the surface, patients who are left on heat for too long or ice for too long can have adverse effects. They can get burns on their skin, both ice burns like a freezer burn or burns from the heat. You can even, for the electrical stimulation pads we have on there, you can even have electrical burns. I know, I actually had them once as a patient. One thing we hope to avoid is any of these scenarios. So anytime you turn off a timer, please ensure that you do one of two things. You either take care of that patient yourself, or you make sure to directly delegate that clearly to another person to take care of. Once you set off a timer, it is your job. You are taking ownership over that patient to ensure that they are not left on a setup for too long. But what about exercise? Isn't that a good thing? Is it more better? No. Like I said, we prescribe exercise, just like a doctor prescribes a medication. If you were taking a medication, you wouldn't simply say, well, the doctor said to take 2 pills every day, so I'm going to take 4 because that'll be even better. That's not how it works. Our body needs balance in all things, and it's the same with exercise. So please make sure if a patient's supposed to be doing an exercise for 1 minute, that when you turn off their timer, you immediately let them know to take a pause, even if you can't immediately address it. And like I said, in very rare circumstances, you might not be able to handle that situation directly yourself. Please delegate it to somebody else who is able to. Please communicate it with somebody else. If you're not able to communicate with somebody else, at least call it to the patient. Hey, John, that was your timer. Go ahead and take a pause. We'll be right over there. What that does is 2 things. It allows them not to do that exercise for too long, and it also allows that patient to feel that they're being seen and understood. Some of our patients will exercise to the point where they can memorize what 2 minutes feels like, and they'll oftentimes wonder, I feel like I've been doing this more than 2 minutes. If these circumstances happen, please own up to them and say, oh, I'm so sorry. I pushed your timer and totally forgot about it. I'm so sorry about that. We'll do our best to make sure this doesn't happen in the future. Again, at first we might be worried to take this approach because we might think it loses confidence and trust with our patient. And it might to a small degree. But in the overall spectrum of things, I think it gains a whole lot of respect and confidence in our future efforts, as they will see that consistently we've been on top of their timers and on top of their flow, making sure that they're not left alone to do their exercises. The biggest thing is that when you set a timer, make sure you take ownership over making sure it's in the right spot. When you turn off a timer, make sure you take ownership over that patient and being able to take them off of an exercise or a setup that they're on. These are important things to us, and we appreciate your attentiveness to this.